link. So welcome once again, and thanks for deciding to spend some hours of your Independence Day with us. We truly appreciate it, but it's for the good of everyone, and we are glad that you have taken time out to feature in this the Italian's program for Independence Day, putting all of us together to see how we can make Nigeria better. So before we go right into the program of today, it would be nice to understand and all of us being in a mindset of why this is important at this time. Um, Please confirm you can hear me, so it's not a case of me speaking to myself. If you can hear me, please just drop a message in the chat box. Okay, kindly confirm if you can hear me. Okay, can you please drop a message if you can hear me so I know I'm speaking to everyone? All right, I just need a few more messages and we're good to go. Oh, perfect. All right, thank you. Thank you very much. All right, so today, for the next few hours, we'll be discussing embracing data innovation to foster nation building. We all know the concept of independence. There's not much to say, and though, like, there's a group I belong to, and someone was like, "What's the motivation to celebrate?" Yeah, well, there are two ways we can choose to say there's nothing to celebrate and just continue and let's see where life throws us to, or many of us
Da
will.
Italiano no.
Can you please mute your mic?
Ah, hello, Chila.
Okay. Admin, please help me here to mute mics. Thank you very much. Okay, so many of us we could choose to complain or just process our Canadian or UK visas and be out of the country and leave Nigeria to whatever Nigeria is, or we could choose to say, you know what, I'm going to do my best, right? We know it takes the whole village, but I'll play my part. I'll do what I can do to make this nation conducive. Like what I agree with that many people say, even if I choose to leave tomorrow. I'm sure many of us already travel out of the country for work, for leisure, and then you come back. So even if you go and that one month you forget everything about Nigeria, there's always a reality to come back to, right? And even if you choose to permanently relocate, I'm not sure how many of us can move the whole of our family members. Like by the time you start thinking of it, extended family members, mother side, father side. So it is just important that as much as we can, we contribute our quota to this great nation, Nigeria. And hence, that is why the Italian has put together this program. Not because we think this program will solve all of our challenges, but what we have decided to do with this is let us see opportunities where we as young Nigerians can contribute to the growth of Nigeria. We'll be sharing a lot of things. Our speakers will be discussing a whole lot of things, a lot of windows of opportunities that are available for us to contribute to explore and would make Nigeria stand side by side with those countries with so much envy. So, not to talk too much. Right about now, I'll be introducing our first speaker. Um, who will be who is a medical doctor in the broad sense of it, but is a pediatrician, and his name is Dr. Ayodele Reina. Is a consultant pediatrician, digital health communication expert. I'm sure many of you see his pictures. Those of us social media people, you would very well recognize him. He's a health blogger and lifestyle influencer. He has 7 years of experience in caring for children in both preventive and therapeutic settings. He infuses a healthy dose of comic relief. He sure does. For many of us that follow his page and see his posts, wit and charm in presenting free public health education and instruction in global practices in childcare by making learning for parents fun and exciting with his online blog on Instagram. So the name is the Noisy Niger Pediatrician. Yeah, so you can check him out. He volunteers for non-governmental organizations like the Ask the Pediatricians and Luvia Health to promote health and wellness to undeserved communities in Nigeria. He has won several awards for his volunteer works. His great passion and career focus is working towards ensuring that no Nigerian child dies from preventable causes. He hopes to achieve this through his medical practice as well as public enlightenment via his various social media and offline channels. He's also the Director of Medical Strategy at Agnosis Care on Demand, a digital health platform that provides home medical care for the elderly and home immunization services for children. This is well, is still a youth in the real sense, relatively young Nigerian who has put his time, his efforts, his resources into ensuring that in this space he has found himself, right? Is making a contribution into the health of children, of the elderly. And who better to open up this session for us? As we all know, health is wealth. That's very beginning, right? Than Dr. Ayodele Rina, who will be starting off um, this session on embracing data innovation to foster national nation building. So, ladies and gentlemen, join me as I welcome Dr. Ayodele to take over from here. Welcome, Doctor.
Thank you so much, Damola, for that very warm opening remark and for that introduction that I wasn't even sure who you're talking about. It's like, is this me? Oh my God. So I'm still a youth, oh, please. Oh, I'm nowhere near Nigeria's age. I just turned 28 last weekend. So guys, I'm still a youth, a very young Nigerian. I'm passionate about everything that Nigeria is, and happy independence to each and every one of you. Can you actually see and hear me very clearly? Let me just confirm that, so that I'm sure I'm not just rambling to myself. Oh, so yes, I think I would like to share my screen if that's possible. Let me see. Oh, there I am. Okay, so there we go. Okay, so let me. Hello. Okay. So the Twitter ban has been lifted, and we've been enjoying to use Twitter for business and productive purposes. So I hope we can adhere to that. So that being said, I mean, I'm really excited to be here because I imagine that I have 15 minutes for this. So I always like when I'm speaking at an event to time myself so that I know exactly when I begin to run out of time. So there we go. So what I'm talking about today is the transformational impact of data innovation in the health sector in Nigeria. Now, we know that data is everything right now. Data is very important. You simply cannot do anything in this life without gathering data. So what exactly is data innovation? Now, the United Nations Development Program has a definition that I'm going to show you soon, but I came across this at the Adena Ogunsoya Mall, and it said that, did you know Surulere has the highest population in Nigeria? Now, I find this interesting because you ask yourself, how did they get this information? So the truth of the matter is that these days in the era of the internet, it's not very hard to get this kind of information because you look at Twitter, you look at Instagram, and you try to find out that, okay, so what percentage of people using Instagram and Twitter or retweeting come from a particular state, and it's so easy to hone it down to Lagos. People put their locations on their devices when they tweet, and then you can say, okay, this tweet is coming from Surulere, or this retweet is coming from Surulere. And it's so easy to do the analytics, these days with all sorts of technology to say that, okay, what is the age group of people that is actually tweeting these things? And you find out that it's actually maybe between the ages of 19 and 40 years, and they are all in Surulere. So Surulere is actually leading the charge when it comes to probably internet use, because you find out that as we go along, you'll find out that internet access is not universal in Nigeria. Presently, only 53% of the Nigerian population uses the internet. And so there might be other youths, in Nigeria, in populations that don't have access to the internet, that might not be tweeting or retweeting. So Surulere might have the largest population of youths actually tweeting or actually using the internet in Nigeria. So big up to Surulere. So if you're repping Surulere, good on you. So this is just a brief description of what internet usage in Nigeria. So right now we have 108 million internet users in Nigeria, and we'll see how this relates to data innovation as the presentation goes along. So data innovation is the use of non-traditional data sources and methods to gain a more nuanced understanding of developmental challenges. And this is from the United Nations Development Program. Now, the idea of traditional versus non-traditional sources of data is very important. You know that traditional sources of data include things like door-to-door collection of surveys, paper, filling paper, actually deliberately going out to go and get the information specified. But we find out that right now, the non-traditional sources of data collection include things like information surveys that you just feel casually on the internet. You know how sometimes on the Instagram story you can actually feel, what do you prefer, asun or boli? What do you prefer, shrimp or turkey? So simple surveys like that. And how much users interact with particular pages, what Google searches bring up. Those are the more non-traditional sources of data. And so by simply going on the internet to engage in particular activities, whether you are shopping, whether you are browsing for a school, these are the ways by which people are collecting data now. So nobody's actually sitting down and sending a paper to you. You are passively giving information, and data is passively being collected. And it's being collected at an alarming rate, in such large volumes, in such a wide variety, and in such alarming volumes that such data is generated to the tens of thousands of gigabytes every day. So what exactly is health? Because we need to talk about health. I'm going to talk about health matters. So health has been defined not merely as the absence of disease, but by WHO as a state of total physical, mental, and social well-being. So you now ask yourself, am I, as a Nigerian, am I healthy? That's the question that we need to ask ourselves, because even though you might not have a disease, the mental trauma that I sometimes go through when I think about my house rent means that, hey, I'm not 100% healthy, that there's something that is still poking my mental health, So health is really not simply about the absence of disease, but a state of total well-being. Now, health and sustainable development goals are very important because, of course, when we talk about transformation in a country, we're talking about how transformation can actually bring about development in that country. And of course, an unhealthy population is unlikely to be a well-developed one, if you would agree with me. Health touches every aspect of transformation and development. And so every aspect of the sustainable development goals actually is related to health in one way or the other, whether it is providing safe water, decent jobs, eradicating or eliminating poverty. All the sustainable development goals actually are related to health in one way or the other. Now, when you talk about big data, everybody talks about big data. So big data essentially, in my understanding, is a situation where people are actually able to collect data at a very large volume, at a very fast rate from non-traditional sources. Now, I got this from the American Hospital Association, in which in 2013, about 153 exabytes, and this is the first time I'm hearing about exabytes, were collected in data in terms of health information. And by 2020, there was a 57% cumulative annual growth rate across 7 years. And right now, by 2020, we have collected, in America, they have collected 2,314 exabytes of health information or health data. And all this data came not from paper and sources, but it came from medical imaging, health information and exchanges of health records, medical devices, wearables like your iWatch, pharmaceutical research, search engine data, smartphones, payer records, state departments and health, and then labs and genomic sequences. So you see that the amount of information coming in as a result of healthcare and health-related information is staggering. Now, the 4 V's of data in healthcare include the volume, in which data comes in at a very large volume, the velocity, the data comes in very quickly, the variety, because you have a spectrum of people that you are caring for in the healthcare sector. So it's not just pregnant women, it's not just adults, it's children. Sorry, everyone, I'm just wondering, is my screen still being shared? Let me just do some housekeeping.
We can't see your presentation. We can
Okay.
see you, but we cannot see your presentation.
Okay, let me share my screen again. So, okay, so is my screen being shared?
Yes, it is now.
Okay, it is now. All right. Okay. All right. So yeah. So there we go. So in terms of the volume, we have a large volume of healthcare information coming in, a large velocity of the information coming in at a very rapid rate. There is a wide variety of information that is coming in, and then of course the data has to be valid and the data has to be accurate and true. So again, are Nigerians healthy? This plate of food really has nothing to do with the presentation. I just wanted people to realize that sometimes when you do online presentations, you miss item 7. So this is the item 7 I'm presenting to everybody here. So this is a multiple choice question, and it says, are Nigerians healthy? And the first option is mba. Second question is no. The third option is OTO, and of course the fourth option is God help us, and the last option is all of the above. From these options that I've given you, it's quite obvious that Nigeria is actually not a healthy population. We are, no matter what it is that we think, we're not a very healthy population, and I have figures to demonstrate this. So numbers don't lie, people do. So if anybody tells you that Nigerians are healthy or even happy, because they say we're the happiest people in the world, I really don't think so. I think it's just something that we tell ourselves so that we don't die of depression. So what are the numbers now? So what does Nigeria's health indices look like? So undefined mortality is one of the very important indices that we use to measure the robustness of the healthcare system of a society. So is infant mortality, life expectancy, maternal mortality, and then the crude death rate. So infant mortality rate is 74 per 1,000 live births in 2019, and this is the World Bank figure. And the world average is 28 per 1,000 live births. So we are really almost triple what the world average rate is. And there is nowhere else in the world where under 5s die more frequently than in Nigeria. So the under 5 mortality rate essentially is the likelihood that a child will die before their 5th birthday. In Nigeria, it is 117 children per 1,000 live births, and it's the highest anywhere in the world. I think some of us that live in the urban areas, Lagos and co, we might not really appreciate the magnitude of this problem. But if you went to the more rural areas, the hinterlands, you'll find out that children actually don't survive so long. If a child reaches their 5th birthday, then they really have done very well. Life expectancy. So Nigeria has exceeded the life expectancy in Nigeria because Nigeria is 61 and has survived up until this point. But we expect that by 55 years, by the age of 54, a man in Nigeria will probably be dead, and by the age of 51, a woman in Nigeria will probably be dead as well. Meanwhile, the world average is 72 years. So we really are not doing well in terms of life expectancy. Maternal mortality, 917 women die per every 100,000 women, per every 100,000 live births. And Nigeria and India contribute 34% to the global burden of maternal mortality. I'm bringing up these figures because it's important for us to understand that, one, we can do better as a nation when it comes to healthcare. And the question is, how can data help us do better as a nation? But I think I need to, first of all, answer the question as to why are we doing so poorly, when it comes to healthcare. Now, so first of all, there's poor access to healthcare, and access can be as a result of, factors like the healthcare facilities are difficult to reach, individuals don't have money to pay for the healthcare, and when the healthcare facilities can be gotten to, they don't have enough staff, and then there's poor, access to, trained professionals. There's poor health seeking behavior. We'd rather just, use, go straight to the pharmacy or use herbs. Insecurity or wait until the thing is out of hand. Insecurity and insurgency, of course, are a problem. One of the reasons why polio was so difficult to eradicate was that it was difficult for us to reach certain difficult places in the northeast, and then, of course, in the internally displaced people's camps, there were outbreaks of things like, cholera and all the other things that can happen when it comes to, living in IDPs, internally displaced camps. So there's also poor education of the population, which of course will translate to poor health seeking behavior. There's a lack of political will. because of course, a lot of the people who can make the decisions can actually travel abroad to access care elsewhere. Corruption, of course, is very widespread and has affected every single aspect of our society, including health. Poor funding for healthcare is another thing, because one thing for them to lack political will, but of course, even if there's political will, are there the funds to fund healthcare? Now, how is the nation slowing down because of these poor health indices? Now, there's loss of GDP because revenue and productivity are actually reduced. Hours of productivity are lost to time off work, because if you are sick, you can't be at work. There are increased healthcare costs because because it's cheaper to prevent disease than to actually have and treat the disease. So once people come down with diseases, it's very expensive to treat those diseases. There's decreased productivity on every aspect of the economy. There's reduced earning capacity, and there's generational poverty. And this is not spiritual, because you find out that once one generation is poor, it really does take a miracle to actually bring those people out of poverty, because once a woman is poor, she's likely to be malnourished. Once she's malnourished, her infant that she's going to give birth to is likely to have malnutrition as well. And malnutrition, especially iron deficiency, can actually lead to poor school performance. And quite frankly, poor school performance almost translates automatically to lower earning capacity. And of course, that ends up being poverty. And that perpetuates its cycle, especially if it's a female, because she will not be able to go to school. So generational poverty. Now, what are the challenges that data innovation experiences in healthcare? So first of all, there's really a lack of internet access. So even though 53% of the population has access to the internet, what about the remaining 53%? They don't have internet, good internet access. And where there is internet access, there is a lack of good internet access. I must emphasize that I know how many times all of us have had to deal with poor connections and bad and slow connections, and then they are promising you a certain number of kilobytes per second and you're getting something ridiculously less. Lack of funding for data-oriented health startups is also a problem. So investors haven't really warmed up to the idea that data-oriented health startups are things that are profitable, and so funding is not. I don't know if the federal government offers grants to such startups, but I'd be interested to find out. Now, hostile business environment in Nigeria is there, so what does the taxation landscape look like, for businesses that are startups? Are, businesses giving some sort of, reduced or tax rebates, when they are starting up, infrastructure-wise, what infrastructure is available? So lack of guidelines governing data collection, because it's one thing for you to want to collect, data, another thing for you to have guidelines to do so. So the guidelines are unavailable. Now, of course, not enough of the population are using platforms where such data can be collected, because these are non-traditional data collection methods. Okay, so I've used 15 minutes, so I'll try and round up in the next 5 minutes. Now, also there's a failure of entrepreneurs to recognize the potential of data innovation in healthcare. So data collection and analysis is very expensive. As the Italian will tell you, data collection and analysis is expensive. Not very many experts who specialize in data in healthcare. So lack of will of healthcare workers and patients to input and submit such data accurately and promptly. I know when they give us forms to fill, we're always like, oh God, how many times will I fill this form? Slow adoption by hospitals and institutions, because we are rather just happy to be paper-based and to just write things and then move things along. And also there's paucity of data infrastructure like fast internet, good servers for storage of information, because it does take time, it does take information, it just takes servers and sometimes even physical storage to actually have large servers that will store all this data. So how data innovation can transform healthcare is that it might help us to do a retrospective analysis of things that have happened in the past. It helps us to make real-time analytics of what trends are happening at the moment, and it can help us to predict what can happen in the future. So how data innovation can transform healthcare includes increased enrollment in health insurance. Right now, health insurance coverage in Nigeria is very poor, but if people could easily just register for health insurance online, the same way we did with NIN, the same way we did with BVN, then it will actually help us to actually capture a large percentage of the population under healthcare insurance. Healthcare will be easier to come by. Health education can be done on such a basis of data innovation, which is what exactly I am, into. So I will show you a bit of my interactions in the last 1 month. Health planning can also be more accurate with data innovation. Policy making can be influenced by data innovation. When you can tell the politicians that, look, this is the amount of millions of naira that we'll be saving as a result of data innovation, when patients don't have to come in when they don't need to, then they will start to sit up and pay attention. There's increased community engagement once you can spread the word faster and wider. If you think about a unified and synchronized and safe electronic medical record, such that if I am in hospital A, I can go to hospital B without carrying a single dime, and all my records, doctor's notes, tests, and investigations can be transferred to the second hospital without me even blinking or batting an eyelid. There is better management of hospitals to save costs. Patient care can be safe and improved as a result of the use of standard operating protocols that can be guided and can be presented on data innovation. Prediction of epidemics and pandemics can actually be done better with data innovation. There's a reduction of costs in healthcare, and then there's the use and adoption of telemedicine. So telemedicine is one of the innovative ways in which data innovation is changing the landscape of medical practice in Nigeria. Now, what solutions are we coming up with? So let's create awareness in public and private sectors on how data can transform the health sector. The private sector really needs to be the one to push all these things, because the public sector always takes time in catching up with what is going on in the larger society. Advocate, larger globe. We need to advocate for legislation to enact data laws that foster health tech development, such that it's easy for health tech to be implemented. Now, we need to invest in training and retraining of medical and data professionals in development and use of data-driven tech. Now, this is where the Italian comes in. Of course, I know the Italian offers courses that actually helps people to do data analytics. And so it's something that is very laudable and it should be encouraged. And as an extra skill, I think I would encourage, myself to actually go and get these certifications. Now, we need to demonstrate to investors the profitability of the health sector and how data can actually drive that profitability. We must improve internet access and interconnectivity between devices, physicians, and institutions. We must also document and publish improved patient and community outcomes as a result of data innovation. Because if we're not documenting that healthcare outcomes have improved and costs have been saved, then we are really not able to show the world that we are doing better when it comes to healthcare and data innovation. We also need to demonstrate significant cost savings in healthcare to lawmakers for increased attention to data in health tech. Now, the truth of the matter is that if you are failing to plan, you're planning to fail. And I don't see how in this modern world one can be planning without data. So this is a snapshot of what my interaction on Instagram. So in the last 1 month, so between the 1st and the 30th of September, I interacted with 120,000 individuals on Instagram. So I was telling them things about how to take care of their children. There was some funny content, but I interacted with 120,000. But think about some 10 years ago. How do I want to interact with 120,000 people? And of course, Instagram gives you all the insight. It breaks down how many were male, how many were female, whether it's Abuja or Lagos. So it gives me an idea of where the people that I might be targeting with a service or product might be. And this is how data can actually improve and affect healthcare and health tech. Now, some other examples include Diagnosis Care on Demand, which I'm the chief medical strategist for. And we offer services such as immunization at home based on information that the patients have given us. They go fill a form online, and then we go and we administer the the immunizations. Neo Child Care, Doctora Health, and Doki Health are all online platforms that offer things like consultations at reduced rates online, so that individuals can have quick, easy, convenient, and safe, accurate access to healthcare. Now, what does the future hold? The use of AI in medicine to predict disease, to diagnose individuals, and to even carry out surgery is something that is upon us. Doctors might be out of a job very soon if AI, continues at the rate at which it is going. Pandemic prediction and preparedness is something that we should think about. Now, people are going into space. What are the health challenges associated with going into space? We don't know yet. So space health and exploration might actually be very important. And as we collect data innovation might be important in telling us what dangers or what issues might exist, with space and space health. Now, real-time health monitoring, such that maybe there will be some sort of device that can even help you to tell certain types of blood parameters even before you actually have the blood drawn. Who knows? It's all innovation. And these things might sound preposterous, but every innovation actually started off in someone's mind. Even if it's impossible, at least they made the attempt to actually get it done. So I think data is the new oil. I think everybody has come to that conclusion, and it's a statement that I think is made quite frequently, that data is the new oil. And to ignore data innovation will be to fall behind in every aspect of human development, including health, actually, especially health. So thank you guys very much for your attention. I went a little bit over time, but I hope it was I hope you got a thing or two from this presentation, and the idea that healthcare can actually improve significantly with data innovation. Thank you.
Thank you very much, Doctor. That was a very insightful one, even for those of us that are not in the healthcare industry. Thank you. So, if you have questions for Dr. Adele, please keep them. After our second session, we would reel out every question. So, if you have questions for Dr. Adele, please keep them, or you could type them in the chat box. We'll try to collate as many as possible. So I'm sure many of us are seeing new career opportunities because I see it now. So despite aside just learning data analytics, why don't I just learn data analytics and see how I can apply to healthcare? You see, it's according to Dr. Ayo, there's a whole window of opportunity for us. If you're not speaking, please mute your mic. Okay. Can you mute? Thank you. Someone please help me mute my Thank you. All right. So, because of these opportunities that we have seen from the very first session, the Tandem is offering an opportunity for somebody here to get a scholarship to the next beginners class. Yeah, that class is worth like 35K. So, because it's Independence Day and because we are patriotic Nigerians, and because from this session up to the end, we would see that there are opportunities for data, the knowledge of data and its analysis. So how do you win a sport? Just nothing difficult, just share as you learn. So we want you to share with your network, on your social media pages, what you have learned and what you will learn from this. So you know those nuggets that hits you, all those key points and data that hits you, just share on your social media page using the hashtag data innovation with Datalium so that we can easily track. And anybody who's got collectively the highest number of engagements wins a scholarship. So you get to attend the next the Italian beginners class on data analytics for free. So we still have like many more sessions to go. Keep tweeting, keep posting, and then we'll be on the lookout. Highest collective engagement. Yeah, that's it. Wins a scholarship, full scholarship to the next the Italian class. So right about now, we'll move to the second session so that we don't waste our time. And our second session, we'll be having Olanrewaju. Olanrewaju, please get ready to present your slides. Olanrewaju is a tech expert. It works at Tech Cabal. I'm sure the name rings a bell to everybody. Yeah. So he's a tech expert who heads Tech Cabal Insight. So it works like at the data side of Tech Cabal. You know, they say data helps you with insight, with and foresight. Yeah. So it gives you insight, and then you're able to forecast and see foresight. So anything you see insight, you know, is data related. So it works at the data analytics research and consulting of Tech Cabal. So you know that for Tech Cabal to give you all those things they give you, all those posts, all those insightful posts, because they have a complete unit that does research, data analytics research and consulting. And he also leads the he has put together a number of reports about Africa's technology industry. Of course, he works with data, covering topics such as fintech and health tech. He recently led a project that produced research for a big 5 tech company in refining their African strategy. And so we'll be having Olanrewaju Odunwo. I hope I pronounced that well. With us today, and he will be talking to us on data innovation and technological approaches to nation building. Guys, join me as I welcome Olanrewaju to take over. Hi, Olanrewaju.
Hi, thank you very much for having me, Damola and Detalium. Could you please let me share my, okay, thank you. I think I might be able to share now. Okay, fantastic. Give me a second. Okie dokie. I'm excited to be here with everyone, and It's such a privilege to be speaking with, I feel like colleagues in the industry that's talking from a data analytics perspective. So, I mean, they've done like a great introduction already. I appreciate that. So my name is Olarinwaju, like Oindamola said, and I work at Tech About Insights. Tech About Insights provides, actionable data about the technology industry in Africa as a whole, not just in Nigeria. Special thanks to to the team at Tekabao, and also to the Detalium team. I call Bode my brother, so thank you for having me, Bode and Detalium team. Let's jump right into it. So let's play a quick game. Are you familiar with this number? It's 200 million. Could you please type what you think this number stands for or what it represents in the chat? And I'll give everyone a minute to type their answers in the chat box. I don't have a gift, for the fastest finger or the right answer, but who knows what could happen. Yeah. Okay, give him more time for everyone to drop their answers. 30 more seconds. Thank you to everyone who sort of answered that question. We have some really smart people here. So if you guessed that that's Nigerian population, you're right. It's a number that is popular in many news articles and publications. It was quite popular in many pitch decks like 5 years, 10 years ago. Like if you look at the pitch deck of any tech founder or tech bro or Texas, you would definitely see that number. The number was depicting the market size and opportunity that exists in the country. And if you kind of look at the graphic on the screen, that population is said to be growing or set to grow, or expected to grow over the next few years. But that number is controversial, for a number of reasons. If you look at my screen, you will see like two sets of images that one of them says the story of how Nigeria's census figures became weaponized. The other one says, are we really as many as 20 million people? The long and short of the story is that we don't know we're not exactly sure how many people live in Nigeria. It is said that politicians manipulated the figures of the 1962 and 1963 census to remain the dominant region in the country. This is because the figures determined not only parliamentary representation, but also revenue allocation and employee distribution in the civil service. So, I mean, I wouldn't dig too much into that, but the fact is that number is controversial. Some people say we're not as many as that, and while some others say, we're probably as many as that. The key question is, if we cannot agree on the data point as simple as population, how do we design solutions to our problems? And this is where data comes in. Data helps us solve problems. A number like census helps you to plan, for whatever government programs are going to be designed. If you know the exact number of people in your country, then you can design solutions to address the issues that they have. Data helps us solve problems. And you will agree with me that Nigeria has quite a number of them. I dare say that the very first step, to solving our problems is for us to start with data. We can't solve a problem that we don't have information about. If you think of a kidnapping case, for example, I know that that's such a dramatic example, but if you don't know the exact number of people that were stolen, where they were stolen, and when they were stolen, it will become difficult to find them, right? It becomes tough to find them, right? And this is one of the key issues that we have in this country. We have a poor data culture. which is why some of our problems, it's difficult to even know where to start because you can't quantify the size of the problem, right? So you don't even know how to solve those problems. But let's look at the case, just a case study, of South Africa, for example. The city of, I'm not sure how to pronounce this, Swane, partnered with IBM in 2013 to launch something called Water Watchers, a big data platform for reporting water supply problems, which means anyone could report leaks in their home, busted pipes, or water supply issues using an app. And then once they report those problems, local officials, whether city council members or water corporation members, could access the database to look at the problems that people had. Let's take an example from Nigeria. Not everything is bad, right? The National Bureau of Statistics is a commendable data initiative. Its website has been like a very reliable source of GDP data, and unemployment figures. If you've seen any unemployment figure about Nigeria, it's most likely came from the MBS. Many of the data points that we have about the Nigerian economy are based on figures from the MBS. There's a concern that some of it is being politicized, but the gentleman whose picture you're seeing displayed on my screen right now, Yemi Kali, I hear he managed to rise above all those problems and provided like transparent numbers during his tenure, which ended in August, 2021. That's last 2 months actually. But there are quite a number of like data initiatives and within the tech industry. I'm going to focus on tech industry a bit because that's where I work. Of course, I had to mention TC Insight first, but the other two at the top are focused on politics and the economy. Shout out to Budget. They've been helping folks try to understand the Nigerian budget, make sense of it. They sort of made like data about the Nigerian economy more accessible to people. In the tech industry, we've got TC Insights, of course, which is your unit organization that I lead. But you've also got people like Baobab Insight, Bridge Tracker, Brighter Bridges. So let's discuss some of the questions that I and some of my colleagues have been trying to answer about the tech industry. One of those questions is, how do we get more women into technology? And like I said earlier, first you start with the data, then once you have the data, you can design solutions to address the problems, right? Organizations like ours and the ones I mentioned on the previous page, we have started to track data and ask questions in some of our reports about like the gender composition, of the tech industry. And the reason why that's important is because once you figure out, the data, once you have that information, then it's easy to begin to design solutions. One of the challenges that we have is we're still not able to go deep, we're still not able to go granular, into this data because, like I said earlier, there's still like a poor, data culture, a poor data culture, across the continent. And, the culture of data is still a new phenomenon around here. But if there's anything to take away from this, it is that the solution always starts with data. This is just like a quick table from the reports that you saw earlier. If you're able to see and look a bit more closely, you will see that it shows like the composition of students in different programs at Unilag. This was data that we captured last year. And if you look at it, the first one shows you, composition of people in computer engineering, male versus female. And you see that like female, you have 19%, male, you have 80%, and it's the same across most of the STEM courses. Computer science, you have about 18% to 83%. It's only when you start to get to courses like mathematics that you begin to see increase. There's still a barrier, around like our culture of, engineering courses are for men, while non-engineering courses are for women, but thankfully that is changing, even though like despite the progress that has been made in terms of getting more women into technology, as recent as 2020, you can still see that this problem exists. But if you don't have the data, how do you solve the problem? How do you know there's a problem in the first place? Now, here's another research question. Please keep me honest with time. I didn't follow the footstep of my last presenter to put on a timer, but please keep me honest with time. So here's another research question. What are the barriers stopping young people from getting jobs within the technology industry? And this was actually a topic of a research project that we recently handled for a client. One key barrier that we find is digital infrastructure. ATCON, which is the Association of Telecoms Companies in Nigeria, says that we have a 15 trillion naira, gap in the digital infrastructure space. We have a 15 trillion naira digital infrastructure gap. Again, we know this because there's data, right? And this number, if you convert it, is about $36 billion. Once government has that number, once the private sector has that number, they begin to, attack the problem. What is the cause of this gap? How do we invest to close the gap? And the solution to every problem starts with data. And if you take nothing away from this conversation, from this presentation, that is what I wanted to take. Now, this is another quick graphic. If you take financial inclusion as a barrier to participating in digital economy, and you dig into the data across the nation, then you might either see an opportunity or a problem. If you look at the graph very closely, you will see that in the Northwest, you have 16% financial inclusion. That 16% people are banked, 7% are, they are financial included, but it's non-bank sources. 9% is informal, financial inclusion sources. And the other number is 68% of them, are excluded. They have no access to financial services, whether informally or formally. And once you see this data as an entrepreneur or just as a consumer, you begin to, you have to conceptualize, the size of the problem and possible solutions. Imagine if we didn't have this data. Without it, entrepreneurs wouldn't know whether to build for the Northwest region or not, or they wouldn't know the scale of the problem. And hence, people in those regions cannot benefit from fintech innovation. This is another graphic, that just shows the size of the problem and also to conceptualize, the scale of the issues that we have as a nation. African nations rank low on business-friendly policies. Regulation is indirectly proportional to innovation. So the more they restrict regulation, the lower there's innovation. And if you look at it, like the countries that have, greater regulatory quality, which is like a bit low touch regulation, but we're not saying there should not be regulation, but it should just be a bit more considerate of the problems that entrepreneurs and the industry is trying to solve. And thankfully, there's work going on with the Nigerian startup bill, which could ultimately, change that story. And you can check out more about the bill at startupbill.ng. I'm going to try and run because time. This is something that I wanted to put in here. I didn't have enough time to put in Detalium, in this. But if you look at it, this is something that you could present to policymakers about the impact that tech companies are having. Decagon has trained, as of February, they trained at 103, persons. HNG has trained, or they've had 7,000 participants. And I'm sure Detalium has trained quite a number of people as well. This data helps us to communicate to government people, or to people in government about, the solutions that are being built by technology people. And by tech bros and techies, as we call them. And so doing, they can design like friendly, exactly. The data element has trained over 13K people. I'm just saying, a message now about that. And this can help like sort of design, friendly policies or convince, government to design friendly policies. Pardon me. So far I have tried to highlight the importance of data and the work that is going on, especially in the tech industry. But how do we embrace data innovation to build our nation? First one is to invest in data initiatives. And I'm excited about the National Data ID project. Hopefully that goes well, and is handled carefully with all, ethical considerations. But that will help us, even see how many people are in the country and what data points can we collect, for each of them. Perhaps we could have crowdsourced citizen solutions, maybe for badge roads, for example. Can we have a platform, where people can report badge roads, in their different local governments? Yeah. Secondly, also invest in data sources, new data sources to collect data. Every time cars are passing through toll gates, is it possible to like collect data on those cars using artificial intelligence, using IoT, or even satellite data, and that will help in policy making, that will help in designing solutions, for our citizens. Lastly, is also invest in talent, invest in training people that can speak the language of data. And that's why I commend, Datalium for the work that you're doing, and even also other, companies and training organizations in the industry. My next slide, is going to display very briefly, but it will show the importance of data science. The data science is becoming, almost as popular as software development. And this is important because we're seeing more Google searches, for data science compared to software development, which means there's more interest, about data science. I'm going to end, I started with a task, but I'm going to end with another task with a game, of some sort. And the first question is, what's a pressing national problem that we have? And I want everyone to take a minute to think about it. What's a pressing national problem that we have? Is it maternal mortality that Dr. Ayo just mentioned? Is it bad roads, like I just mentioned? Do we insecurity? Thank you. Do we even know how many people have been kidnapped in the country, for example? Do we know? Do we know where? Do we know where in the country we've had the highest number of kidnap? Do we have sufficient data about it? And lastly is, can you as a person, can you as an organization collect data, about this problem and visualize that data? Like some of the graphics you've seen me display, exactly corruption, how corrupt is Nigeria? Can someone visualize that problem? Can someone collect data about that problem and show it to people so that then we can begin to quantify the size of the problem? We can begin to see, how to solve the problem, because like I said, the solution to every problem starts with data. The solution to every problem starts with data. Thank you for having me. And if you take anything away from this presentation, it is that the solution to every problem starts with data. Thank you so much, and God bless.
Thank you very much, Alarewaju. That was so much to take in, and so much of establishing the need for data. Like, see all the points everybody has put up, and obviously there is no enough or accurate data. Guys, this is a window. This is an opportunity where we can tap it. There's no way Nigeria can be better if we don't know our problems, and one of the ways of knowing your problem is having adequate data. At this moment, we'll be taking questions, questions for Doctor, questions for Larry Waju. If you have questions from their session, please drop it in the comment section, and we will address it immediately. Please note we have just about 10 minutes for this. Kindly drop your questions in the chat room so we will respond to them and move on quickly to the second phase of this program. All right, do we have any questions? I'd give another 5 minutes. If I see no question, we'll move on quickly. Questions, just type in the chat room if you have a question. I'll read it out. Okay, I see someone raising their hands. Kindly type your message if you can, and then we'll read it out. This is just to ensure that we keep everywhere as sane as possible. So please type your message. Let me see whose hands are raised. Deborah. Deborah, kindly confirm you would prefer to say your question instead of type
Sorry,
it.
I'm trying to type it, but it looks very long. So, okay, if we are trying
Okay,
to
yeah.
like get data concerning the problems of problems in Nigeria, how do we get it? Because even these Bureau of Statistics, they don't even have the data for most of these things. Like if we want to analyze data of how people get kidnapped monthly, and we're trying to see if the trend is increasing or reducing, and connecting to how the police force is solving these problems. Okay, how do we get it? I mean, it looks very hard.
Okay, I think this question actually applies to both speakers, but I think Olaruwaju might be in a better position to respond since it's quite generic. Olaruwaju, you want to help us with that?
Yes, I can try to answer. I think the first thing I agree with you. Data can sometimes be difficult to come by, and this is one of the challenges that we have. But what we find is there's actually a lot of data out there. Some of it is dated. But if you dig online, for example, some you can find World Bank data. You can find some of that. But even when it's not available, you know then we have to commission, data. Then we can do like small polls, quick polls. So you can probably start from where you are, get your friends, and say, oh, 20 of you, I have this question I'm trying to answer. How many of you have bought, data in the last, maybe you're trying to find out how expensive is, mobile data. And you say 20 of your friends, how many of you have bought data, in the last few weeks? How much did you buy it for? How much of that is your income, or your food money, like we usually say, and you can start with that. You can do this for some of the problems that we have. Insecurity, for example, you can probably scrape, data for the different news reports about kidnappings, and there are probably like a 100 of those online. You can scrape websites, and then try to like collate the data, sit down and collect data on those kidnap cases, and try to compare, where did this happen? If there's any information on, on how much ransom was requested, you can use that on, on the mode of kidnap, you can also use that, So I would say don't worry much, except maybe you have an urgent project or it says, then I would say don't worry much about data that does not exist. There is a trove of data, and I'm telling you this, online that exists right now that we've not even utilized. So let's start with those, before we start worrying about data that doesn't exist. And even for data that doesn't exist, if you don't have the huge budget to commission like large research projects, you can start from where you are. You can ask a research question amongst your friends. You can scrape news articles for those, for some of those, but let's start from where we are.
All right, thanks, Olaruwaju. So the takeout is start from where you are, use the data available. I know it's going to take some work to actually scout for these data, news publications, and all of that, but it is available, so it just takes us collating the data. The next question we have is from Justin, who says, what's the major challenge of obtaining data in Nigeria, and what can be the remedy for that? The major challenge of obtaining data in Nigeria and the remedy for that.
Oh, is that for me? Oh, yeah.
Yeah, Olariwaju, please go ahead. Yeah.
Okay. I mean, the major barrier is we just don't have the culture of collecting data. If you look at, and it starts from something as simple as national ID. If you look at other nations, there is a data point on every citizen. In the US, for example, once people are born, they are assigned a number, and that number follows them through until they are dead and gone. And it helps the government to plan. It helps people to the government to collect real-time data around, their citizens, for example. So in 2020, many years after some of that countries already have national ID, we're still discussing, collecting data on our citizens and all of that. I'm happy with the progress that we made, but it's just that we don't have a culture of data. And aside from this example that I mentioned, and you can even look at it, people like to hide information about themselves a lot. It's just the culture. You don't want, maybe for the fear of, I don't want them to isolate people, for example. And when you ask people questions for research, some of them don't want to answer you. They probably want to cage their answers, and all of that. So we just don't have like a culture of data. However, we're finding that with the right incentives, people will answer research questions, and with the right systems in place, you can get the right data, around people. And I think that's again, I'll repeat my other point around starting from where you are, because what I found is if you worry too much about what does not exist, you're going to get into some of like paralysis. I'll call it problem paralysis. So let's look at what exists. I can see someone talking about BVN, for example. There's data on, there's BVN data, for example, and some companies are already using this. I know fintech companies use BVN, for example. Up until recently, they were using BVN to get data on people, verify that this person exists or is not a fraud and all of that. So let's start from what we have, and then we can begin to slowly build a data culture. I'm sure when we have information on everyone in the country, then people will begin to get used to the whole concept of data collection. I hope that helped. I think I rambled a bit, but I hope it helped.
All right, thanks, Olariwaju. And I guess you've also answered Dal's question on where data can be gotten. So the question that has Vivian and name was from Ruben, who says lots of database on macroeconomic issues are standalone. Integration and modeling of these sources will make accessibility and insights easier. Like for instance, e.g., imagine we have BVN, name, passport, etc. Integration to help in the fight against insecurity. What practical advice can we give to the government on the way forward on this? Yeah. So I think a summary of the question is we have some data already. We have the BVN name, our passport, driver's licenses, and it believes that integrating these data and modeling them will give insight on maybe, for instance, the solution to or fight insecurity. So what advice do you think we can give the government on way forward on using this data to solve problems? Yeah, I think that's what the question says. So what advice? I think I would also have Dr. Ayodele, if he's still on this call, to come in here, because also apart from insecurity, we have health or medical issues. So Larry, you can start while I check if Dr. Ayodele is still.
No, I'm here. I'm here.
All right. So
Yes.
what would you suggest here? Yeah.
Okay, can I go ahead? Okay,
Yes,
so
please.
yes, I mean, I totally agree with Ruben's point about how data needs to be integrated. We have a lot of data that is quite fragmented, and so we've got NIN, we've got BVN, the driver's license, passports. So I think part of the challenges that the government is experiencing is that if you were to integrate, these schemes or these methods of data collection and gathering, either you would get rid of some ministries, departments, and agencies, which would mean that you would render some people redundant. The government will have to let some people go, which the government never wants to do. Civil service never wants to shed too much weight, because it's paying quite a handful of people, a lot of things, which is why NYSC will never be scrapped, by the way. NYSC is a full institution on its own. Either that you integrate them and shed some staff, or you create an entirely new agency to integrate and manage these particular, all this data. And of course, creating a new department or agency also requires funding, and the government is actually looking for funding at this point in time, in every direction in which it can turn. And so I'm not sure that the funding is available. So in my opinion, I think what I would actually now, of course, when it comes to health, there are really very many challenges. Data gathering is still not digital. Data gathering is still very much analog. People are filling forms. COVID-19 actually tried to make a lot of healthcare system move from, analog, methods of data collection to digital methods of data collection. And so, they will collect and transmit their data digitally. And that was something that was quite laudable, but it still isn't very widespread. It's related to COVID-19 because this was a pandemic and the response had to be that accurate. But when it comes to other things, like the daily common diseases, what number of children die from malaria, what diagnosis is being made, are we transmitting diagnosis that we are making from the point at which the care is administered to the central body that is collating this data? I'm not sure it's happening at the rate or with the accuracy with which I imagine that it should. And that's just the healthcare sector. Now, when it comes to the whole issue of the macroeconomics and planning, again, I agree with you. I agree with you that it helps in planning if you are able to integrate all this data, because planning really is about numbers and population, predicting how trends will change based on what the trends are now. So inflation rates, can we predict what the inflation rate will be? I know there are a lot of variables. There are a lot of variables, things like, because unfortunately our economy, is really, really oil-based, and so that is really what the fluctuations in the price of oil, will affect the economy quite adversely. And so somehow diversification of the economy, of course, is something that we need to pay attention to. So we need to start asking ourselves, what data are we gathering from the other sectors, of the economy that can actually, bring some revenue in, and say, okay, how much is this industry making at this point in time? What is it likely to make in a few years' time, including health? Because health can be profitable. It's just that we haven't been able to harness that power, because a lot of Nigerians, of course, are not under any kind of insurance scheme. And I think that, once we can actually harness that power of, the insurance schemes and then data, I think we can actually move forward as a nation as a whole. But I totally agree with Ruben that, there's way too much fragmentation in data collection, analysis, and there are just too many avenues by which data is being collected, and it's not integrated to actually make a harmonious or come up with a harmonious position for development. And I think I don't have the direct answer to that, but I think I have the reasons why it's still as fragmented as it is.
All right, thanks very much, Doctor. Unfortunately, we have zero time left for question for this segment. However, every question that has not been answered now will be answered at the end of the next segment. I actually also believe that the next segment will answer many of our questions, like opportunities available for me as a data engineer. How do I get into tech? How do I get data, actual data? Many of these questions might be answered in the next segment, and if they're not answered, we'll try to address them at the end. So right about now, we'll be moving to the second phase of this program. Thank you very much, Dr. Ayo. Thank you very much, Olanrewaju. Please stay on, because we still have questions for you, and please keep sending in your question. And don't forget, in order for you to get into this data train by joining Datalium's beginners class for free, Share what you have learned, share what you're learning with your friends and loved ones on your socials. Use the hashtag data innovation with Datalium, and you will be sure to reward the person with the highest collective engagement with a free pass to the next beginners class. So for the next session, we'll be having a roundtable, right? Where we'll be having professionals across different industry tell us opportunities available. So I'll be invited to our roundtable. Just imagine the table in your head, right? But to this wonderful session, Linda Ochubwa, Husseini Kwari, Miriam Longe, and Temioluwa Vogan. I'll be okay. What I will do, thank you guys for coming on, is introduce her panel one after the other, starting with Miriam. So Miriam is I'm sure we see a picture. For those of us TV watchers, mind me, I'm on almost every channel, media channel. She's a co-host of the View, of Your View, sorry, on TVC, the very popular TVC program. She's an advocate. So Miriam Longe is an advocate for healthy living and the founder of Lifestyle with ML, an accountability coaching and mentoring platform that empowers women to achieve and maintain a healthy lifestyle through good diet and exercise. She's also a host of the TV program Your View on TVC, where she lends a voice to social and political issues, and she'll be throwing more light and knowledge on lifestyle as an innovative approach to nation building. You're welcome, Miriam. And so it's a ladies first thing, right? And the next lady on our panel is Linda Ochubwa. She's a seasoned expert in marketing and sales with over 13 years of working experience. She kicked off a marketing career in riding oil and gas before proceeding to the UK, where she bagged the first class honors from the University of Surrey with a MSc degree in management. She currently works as digital sales manager of Business in Nigeria, the leading business newspaper in West Africa, where she digitally transformed the advert department, leading to increased revenue. Linda is a name to reckon with in the business space, and she'll be sharing our business knowledge as we deliberate on data-centric and innovative approach in nation building. Now to the guys. The first guy on our panel is Temioluwa Olufemi Vogan, who is a legal practitioner, passionate about his international, commercial, and business law. He believes so much in mindset reorientation and empowerment to cause a massive and lasting change. Temi also believes in nation building with the notion that to build a nation, people must first be enhanced. As the founder of This Generation, an organization dedicated to raising a new generation of youths with the right mindset who are empowered to contribute their quota to national development. Temi will be speaking today as he shares his knowledge on the NGO sector, on solid and innovative means to foster nation building. And the fourth person on our panel is Husseini Kwari, who is a tax consultant and public sector consultant. Husseini is an economic and a public servant with more than 10 years of experience in taxation, administration, and analysis. He's a member of the Associate of Certified Chartered Accountants, ACCA, and the Institute of Chartered Accountants of Nigeria, ICANN, an alumnus of the University of Surrey, UK, and Oxford Brookes University, where he obtained a master's degree in energy economics and a BSc degree in applied accounting, respectively. Husseini has been actively involved in following tax through, which he continues to advocate for improvements in fiscal transparency and accountability in Nigeria. Husseini will be speaking today as he emphasizes on the role of the public sector in fostering national development. So that is our panel, and I'm sure everybody's here ready. You can see from the introduction that we have experienced people in our midst. So we'll just be taking the question through just the way we have introduced, right? I think starting just the way the introduction took place. So my first question would be to Miriam. Miriam, can you just do, so we already introduced you, can you just tell us about what you do, right? And the sector you play in, the lifestyle sector. Can you just introduce it to us basically? And then as Nigerians, how do we fare compared to other economies in that sector? Yeah.
Thank you so much. Hello, everyone. My name is Miriam Longe, as earlier introduced. So I am first of all, a mother. And because of that, lifestyle is really important to me, how my children eat, how I'm trying to raise children who are well-rounded and, healthy and thriving. And so that was where my interest for lifestyle started. Simply, people would say lifestyle encompasses our diets, our habits, our cultural and social values, and our general attitude towards issues that affect our health. And Nigeria has its own unique lifestyle, you would say. Like if you were just take a snapshot of the Nigerian lifestyle, you can tell Nigerians love their food, and also that when it comes to issues that concern our health, we tend to lump it in the God has got that, for us. And I feel that sometimes this may be as a result of maybe not enough information, and that can come because of not enough data that many of us can refer to, So if we're to look at some of the data that we get, it's usually from the UN, the World Health Organization, our counterparts in America and the UK. They'll give us information like in developing countries, most citizens have developed like a less active lifestyle, and we have very poor eating habits. And we get information like unhealthy diets are now greater threat to global health than tobacco. So when they say that, what are they saying really is that what we eat, how we eat, if we are moving, are we sedentary, all these sort of things affect, our lifestyle and eventually affects our health and just our general well-being, if we're thriving, if we're happy, if we're healthy. So most non-communicable diseases like coronary heart disease, and the doctors in the house, I hope I got that right, diabetes, what else would you say? A few others have a lot to do with our lifestyle, what we eat, the sort of foods we're eating, And so what I try to do for myself, for my family, and for my clients is to give them information on what is healthy and what is not, and what the better choices and habits they can adopt to have a healthier life and live, a healthier life, so that they see less of the doctors, or by the time they get to see the doctor, when they do see the doctors, it would not be for something that their health and their lifestyle would have, helped to avoid. Thank you.
Thank you, Miriam. That's a good introduction on what we should be expecting. But my follow-up question would be, side by side, other nations, right? How well do you think? So I know you already mentioned that many Nigerians leave their health to God, if I can put it that way, right? But the industry as a whole, the lifestyle industry that addresses this concern, how developed do you think we are compared to what is applicable out there?
It's in Nigeria, the lifestyle sector is one that I would say it's growing. It's in its baby stage, if I may use that word, because healthy lifestyle especially hasn't been, at the top of our list for many Nigerians, really, because when you look at the African story or the Nigerian story, and you're talking about food, most times you focus on the fact that there's starvation and, malnutrition, even though that is very true for most of Nigeria, for some parts of Nigeria, it is not true for the growing middle class. So because of where we have people who were earning more, we have access to processed foods that are coming from the West, things that normally we just watch on TV, it has now become part of our lives. We don't even understand the different nutritional benefits of this food, the ingredients that make up this food, and we eat it. And then also, because of our increasing finances, we're able to buy cars, we have machines to do things for us. So we're watching TV more, we're not active anymore. And all this combined has brought with it its issues. So you find yourself in the hospital and the doctor is saying you need to move more, you need to change your diet and things like that. So that has now brought into consciousness of people the importance of lifestyle. So it's still something that many Nigerians are still trying to grasp, although the number has definitely improved over the years. So when you compare us to countries like America, like the UK, we would say that we're still just struggling to understand the concept. Most people who really pay attention to lifestyle would be a certain group of people in a socioeconomic, class, people who are probably educated, people who are a little bit more exposed, but, the regular Nigerian in the rural area may not be thinking about that. And yet, the effect of a bad lifestyle affects us all. I hope I got that. I answered your question.
Sure, I did, Linda. Sorry, Miriam. Linda, so this is like your session now. For 5 minutes, can you please just introduce your industry? And just as we asked Miriam, let us know how well is it doing, right, in Nigeria, side by side, how it could be, right? Like what is applicable as of now. So give us an introduction to the sector you're playing and tell us how we rate, yeah, basically side by side what is applicable in the world right now.
Okay, thank you very much. Good afternoon, everyone. So nice to be here, and I hope I'll be able to share some of the experiences that I have and knowledge over the past few years. So my name is Linda, as mentioned. I presently head digital sales for Business Day, and I have worked in the digital unit for about 4 to 5 years now. I did take up some roles earlier, but now I'm facing digital. So I would like to start with something I read, back a few days ago, and it was saying that there is so much data everywhere, but very little wisdom, in the sense that we have a lot of data around us, but we are not using it well. So if we cannot analyze the data and then use it to improve our lifestyle, then it becomes a very big problem. And a lot of people are beginning to try to see how they can use the data, which helps them in making, informed decision in the things that they do. So you can see the telco guys know when to send you a message and when to call you, because they can see that your data is running down and your airtime is running down, and that you need to buy more to recharge to keep calling, because they need to make more money. You can see that the telco companies are also kind of partnering with the media houses to see how do we make, this information and this news available now to more people. True, we used to have the MNS, and now they're also seeing how we can digitalize move from the print media to becoming the e-paper or digital media, and then sharing it to many people. But during the course of this whole preparation for this event, I was able to go online, and then I found out a lot of research and things that have been done. And the thing that's happening right now is the fact that most of us here right now have a form of ID card, like the doctors, the people trained, and those of us who have to travel. You either have a passport, you have a BVN, you have NIMC number, you have the former national ID card that all of a sudden isn't useful anymore. We have ID cards, but then with the research that was done by EFINA, we found out that most of the poor people do not have any single form of identification, and this will affect a lot. So, number one, if you don't have any form of identification, you cannot open a bank account. You can also not really transact or do business, because I need to be sure who you are. So it means that a lot of people on the streets don't even have any form of identification. Well, at least we had moved from about 40 million to like, I think 61 or so this year, which means that at least we still have over almost, let me say, 200 million people that we cannot identify. Now, if these people cannot be identified, they also cannot open banks, they also cannot access financial inclusion and the things that can help their life be better. They also cannot travel. And then if we now go to the extent of talking about security, you can't even identify the person who has performed this evil act on the road, because you can't find him. There's no identification. You don't know where he lives. You don't know you don't know. So there are so many people in Nigeria. I was speaking to someone, I was saying, like, so many people will live in this country and pass on, and you will not know that they even existed. Because at least in the UK and in the US, when you are born, you will have your record. There's a record to show the date, the time, and stuff that you're born, and you're even given a passport. And then you can even find your parents if anything happens. In Nigeria, you can't really track or find anyone, which means I don't know how long it's going to take us to get there. I think the NIMC is a start, but then it's still a long process. Now, what we've also been able to do is the fact that we in business, we strongly believe that data is king. So if you're coming to us and we don't know who you are, then it's a big problem. So we want to be able to access who you are. So we're saying, okay, let's have a kind of paywall on the page where we are able to get information about people, your name, number, and email. So we can actually also come to you if you don't come to us, which means we can actually track what you read, when you read, why you read it, and how you read it. And then we can say, okay, these stories are trending, and then we can prepare to make sure that we have what you like. Now, I will bring that a bit to business because I deal with a lot of small businesses before I round up. One thing about businesses in Nigeria is that you hear someone just wakes up and say, oh, I want to start selling pure water. And then you're asking, do you really think people need pure water? The person said, I think people might need water. He thinks, he's not sure. Now, the only thing that gives you that proper information is if you have done the proper research and you have this data and you've been able to analyze it properly, then you will reduce your risk of having a failed business. So you see many businesses fail. They're not failing because they didn't have a proper structure, or they're not doing things well. They're also failing because they didn't have a proper research, they didn't have a proper data, and they didn't analyze that the market is ready for what they want. So there's no how you start a business in the UK or US without doing a research saying, okay, who will buy my product, where, when, how much do they want to pay, how many of them would they be willing to pay for it, will I be able to make profit and not run at a loss, will I fold or still remain in business after 5 years? Like the person is already thinking of 5 years ahead. But in Nigeria, we leave everything to chance, luck, and prayer. I don't have anything against prayer, I love praying, but then if you don't have proper access to information, research, and analyzing that data, almost everything is going to fail, from our healthcare to security to business. Everything around us is now dependent on data. As they say now, they say data is king, right? But how well you use that data makes you a better person. Thank you very much.
All right, thank you very much, Linda. Quite insightful. And I liked how you related it to business. I'm sure many of us here are young business owners, or at least we are working in a business. So right about now, we are going to have our third panel member, Temiloluwa, come to speak to us on the NGO sector, how that is faring in Nigeria at the moment, and how the opportunities actually available for it, putting it side by side what is applicable in the world. So welcome, Temiloluwa. Please take the stage.
Thank you very much. I must start by saying thank you to Data Long for putting this together. Happy Independence, everyone. Linda, thank you very much for your conversation. I mean, while you were talking, I was already thinking of ideas and things, problems you mentioned and ways to solve them already, right? And I think that's one thing that we do very well indeed. So, I mean, I know everybody is saying NGO, but I want you to know today that NGO is a career, right? It's called the third sector. So it's different from the private sector and the public sector. It's the third sector, it's the development space, right? And what we do in that space is to be very honest, if you're in the development space, it's a space that really helps the government, right? Because what you do is that you create services to enhance the lives of people, and you contribute very effectively to the economy, right? And I think one problem, I really feel like in Nigeria, the development space is not really thriving because we don't really understand the space, right? A lot of people don't even know that it is a career path. So I'm a lawyer, I'm an entrepreneur, and my development sector is another kind of career for me, right? It's a space that if you come in with understanding, right, you would be able to thrive in it, right? And so what we do majorly in Nigeria, and this is not to talk down anybody. What we do majorly in Nigeria is go into a community and just give out food and leave again. And that doesn't really contribute to anything. It doesn't really help even the people that are in that community, right? I'm going to just use some examples to explain to us how important data is to the development space, right? So there's this community where we're going to do some work, right? And they just went into the community, thought that, okay, this community, they didn't have any hospital there. And, it was an oil and gas company, and they built a big hospital, equipped it with all of the machines and everything. I mean, it was very well equipped. And the hospital started, they got very experienced doctors and everything, and it was fun. And nobody in the community went to the hospital. And they were confused, like, okay, we built something extraordinary here. Why aren't you guys using it? And so they now called an expert, a developmental expert. And I mean, she asked them, one question she asked them was, before you came into this community, did you engage the members of the community? And they said no. So they said, okay, no, let's engage them. And they realized through collecting data, that the people there had old women that they believed in as the midwives, something like that. And they never believed in the hospital system. So if they wanted to give birth and all of that, they went to those old women, and those people helped them, right? And so what they did was they actually now got those old women, they trained them, and people started coming to the hospital. And this has happened a lot in the development space, because people just get into communities and say, okay, I want to help this community. And just like Linda said, we don't do proper research. We don't get data. Even when I wanted to start a business, I had to collect data, right? To understand what people, how this service will actually help people. Yes, you might have an idea in your mind, and that's how, people who are in the NGO space and all of that starts. You have an idea. Okay, I want to contribute to the economy, or I want to get into this community and help them with education, or I want to help with healthcare or whatever. But before you can be able to put that idea into proper perspective and actually solve problems, because when you come into this space, you're not just here to just do anything. You're here to actually solve problems, right? So you want to take a particular SDG goal, and then you want to be able to see how can you break it down. And all of that can only be gotten, when you have proper data. You have gotten data. And I always say something, I feel like for the development space, because you can't get on Google now and ask. For instance, I work with a community, it's called Oroshoki community. When I started with the community, there was no way I could go on data on Google to say what does Oroshoki community have security. But that's one thing that they had security issues. There was no way, right? I had to go there and actually get the data myself, right? So I think another thing is that if you're in the development space, we actually sort of help to get data that can be used, right? So if we get into a community, we're getting raw data from interviewing people, from doing surveys, and then this data can actually be collected and put online, and actually it begins to help people, right? So you see that if you're in this space, you're actually contributing a lot, to data collection. So I'm hoping that from this conversation, we understand a bit what the sector aims to achieve, so that you understand that when you are coming into the sector, for those who might want to, I think everybody is interested in doing one good thing or the other, but you have to understand that for it to be effective, you need to be able to collect proper data. And then when you are able to collect that proper data, then you know how to go about solving whatever SDG goals you want to solve. Thank you.
Thank you for that brief yet concise and impactful introduction, Temi. So right about now, we are going to have Hussaini, who is now going to tell us about the public sector, and also let us know how well we are faring at the moment. Hi, Hussaini.
Hi, everyone. Good morning. Oh, sorry, good afternoon. Happy Independence Day. Let me first of all appreciate the earlier speakers. Like, this is an incredible speech, and appreciate everyone for what has been said earlier on. Now, as I've been introduced, my name is Hussaini, and I have been in public sector for about 11 years, and basically focus on taxes, oil and gas to be specific. And recently we saw the passage of the Petroleum Industry Act 2021. Were very instrumental in the passage of that act. And the reason is this, realized that in the last 20 years, coming to Africa in terms of are not benefited from this investment. In fact, what we realize is that many oil companies are just leaving the country. And one of the reasons is the fact that there's so much uncertainty in our industry. And that's why there was so much pressure and need for the passage of the act. And let's see how this thing will turn the tides of our investment. I'm also very instrumental in the passage of the Finance Act of 2019-2020. And the reason why I'm raising this here is because one of the great things we did with the Finance Act is we decided to see how we can reduce the tax burden on small businesses. So by small businesses, I mean businesses with turnover of less than 25 million. And you can see we've successfully eliminated all forms of taxes for them, including VAT and company income tax. Unfortunately, in recent times, you can see the VAT war that is going on with the state governments. That might probably affect new businesses, businesses that are below 25 million, because most of the new VAT laws being passed in states like Rivers, Lagos, I don't think the new businesses will enjoy this incentive. But there's something I want to raise, and Dr. Reina actually raised it. He said, yes, what are the incentives that government can give, especially small businesses? Yes, these are some of the things that government can keep doing. How do we promote small businesses? Because that is the bedrock of every economy. This is how we can grow our economy, and we need small businesses to grow. We need them to strive. And I'm hoping that as we continue moving, because what we want is that let this Finance Act be an annual thing. Every year, we should be able to look at our tax laws. We should be able to look at our fiscal policies. What are the changes we can make in order to make small businesses and small business owners at least be able to be profitable? And you guys know about the new African Free Trade Agreement that we just signed. Is it AFTAC? Yeah. So we need to see how Nigerian businesses can actually penetrate African markets to strive there. Another thing I want to raise is the issue of financial inclusiveness. Now, the problem we have is that in Nigeria, we have a lot of people who are not in the tax net. And unfortunately, probably that's why some people feel the burden of taxes, because our tax net is still very, very low. In fact, if you look at what is going on in Nigeria especially, you realize that there are so many people that we don't know who they are. From the day you are born till the day you die, government has no record of whether it ever existed or not, especially those in the rural areas. So how do we build this robust data where we can capture everybody? We can know who you are. We can know what taxes you should pay. We should understand how we can also give you certain incentives to help you grow. These are things that data is going to help us. And I'm glad that the Italian has put in this conversation. And I think it's something that we should keep discussing about this. Recently, we're discussing about and this is Nigeria, South Africa, Nigeria being the largest economy in Africa, South Africa following. And why is that they have so much more tax? Nigeria has a very, very big informal sector, while South Africa has a bigger formal sector. So it's very, very easy for you to collect tax revenues from South Africa than it is from Nigeria. But large, this is what I do. Like, I'm just involved in taxation. I'm also involved in fiscal regime and make businesses do better. Thank you.
All right, thank you very much for saying. Though you had a bit of internet issues, but the next and final phase of these questions, I just start with you. How do you think data collation, data analysis, data presentation would help our tax industry or the tax sector better? Do you think we work with enough data at the moment? And if not, what are the opportunities available for someone going newly into data science, for someone to explore collating and analyzing data? What are the opportunities currently available in this sector that we can explore to even make this sector better?
Okay, so let me start by saying this, like Olarwaju said, he said the solution to the problem begins with the data. In order for government to create the problem of data, he decided to bring in the Nigerian Bureau of Statistics. As to how far the Nigerian Bureau of Statistics has been able to meet our data needs is still something in question. I know that they have given us reliable information, and this is what we continue to rely on. But the question is this: despite the fact that we have Nigerian Bureau of Statistics, why do we still rely on external data from the World Bank, from IMF, from other developmental agencies for our data needs? That's one area where we hope small companies or small startups, especially that focus on data, can help government meet this gap. Let me give you an example of how data is important. Now, the reason why we decided to, in Finance Act of 2019, to do away with taxing small businesses is this. We realized from World Bank record that 90% of the taxes collected in Nigeria is just generated from 10% of the companies in Nigeria, just 10%. So the remaining 10% is generated by the 90 other companies, 90% of the other companies. So next question is, why will government waste so much time, energy, and resources pursuing 90% of the other companies that can only generate 10% of the revenues of small businesses, especially those guys in the tech? How can they help? We need them to come in and partner with government. Let's tell ourselves the truth. When it comes to data management, when it comes to data, government is very, very bad at it. That's why someone raised the issue of why do we have passport? Why do we have driver's license different from, their BVN, because government has not been able to efficiently manage data in such a way that it's going to be of good economic impact on us. So the question is, how can the private sector come in and assist government? And there are companies doing that already, or there are NGOs doing that. I know of Budget, at least Budget, since they came on board, they have helped in improving the general transparency around budget. They have helped in making simple budget items that might look complex, so simple, using just infographics, and they're doing well. So moving forward, I expect Detalium and other companies like Detalium to be able to partner with government agencies. How do we help you guys in keeping data? How do we help you guys in making sense of your data? How do we help you guys in planning? Because data is supposed to be an important instrument of planning. So I think these are little ways, in my opinion, where small businesses can always help government with their data needs.
All right, thank you, Sani. There you have it, guys. There's an opportunity to approach the government and help them better manage their program. And this is only when you have a good knowledge of data science, data management, data engineering, or data analytics. I think this also applies to Ruben's question on how to make the government make sense of these very many sources of data that we have. So, Temioluwa, I would ask you the same question on so this the NGO space. I know you made mention of some people approaching communities without even an understanding of their needs. So do you think, how do you think is the best way for anybody venturing into the SDGs movement and NGO movement, the best way, the opportunities available to provide data to these people, to collect data for these people, and all in all make the sector better? So what um data collection or analysis opportunities are available for us in the NGO SDG space? Timnolu, over to you, please.
Okay, thank you very much for that question. So, just like I mentioned at first, anyone who is interested in causing a change, right? Maybe you've seen a particular problem, maybe in a sector, in a community, or anywhere, and you decide, okay, this is what I want to solve. Let me give an example. Maybe you want to solve poverty, so maybe you noticed a particular community and you feel like what's the problem in that community is poverty. Now, you can't just go and say, okay, I think the solution is to give them food or the solution is to give them jobs. You now need to be able to get into the community and have conversations with them. So when you are and conversations really is data collection, right? So you're asking questions, surveys, one-on-one conversations with different people in communities, with the heads of the communities, with different members. They have obas, they have the, so you're going in, with the mind that you want to be able to be a part of the community, understand exactly what they're going through. Now, when you do that, your idea is you want to solve poverty. But when you do that, then you begin to see, from having those conversations and going in there, you begin to know exactly what the problem of the community is. Now, let me give you another example. There's a particular community that we try to go and help, right? And we just noticed that, okay, maybe education was their problem, right? That's what we thought. And we realized that yes, they did not believe in education because they believed that any girl that is educated will not get married, right? So while education is their problem, the approach we now had to do was to say, okay, these people have made a mindset for education. So it took another time of having conversations, of helping them understand the essence of education, right? So you can't just get into a community and say, this is what I think the problem is. You need to be able to collate data. You need to be able to have conversations with them. You need to be able to go in there, and get your hands dirty. And that's the first thing. So you see that it's not just about going into a community and saying, I'll keep it. It's a lot of work, right? So I mean, that's really how to go about it. You know that you're getting to that place, and then you know that, okay, this is what I want to solve. But the data you collect helps you to streamline it and helps you to know exactly how to go about solving problems.
All right, thanks, Timmy. So I have a follow-up question, right? So aside that, for the guy that wants to go solve the problem, do you think there's an opportunity for people who are really just data analysts to focus on getting and analyzing community needs, which they can now provide to these NGOs or SDGs to then follow up on? So an opportunity where people can, their specialization would be on community data, right? Community need data, and all they are doing is as assessing, right? Accessing, assessing, and then analyzing this data to provide to SDGs and NGOs and the public sector who would then want to follow up to solve the problems. Do we think there's an opportunity there for people?
I mean, so as you mentioned, the way my mind works a lot, right? So as you mentioned, I'm already seeing another problem and a solution to it. It's an area that is untapped. I feel like what you just mentioned, we don't even have anybody doing that. And it really helps because most of the non-governmental organizations work with communities. And one of the problems that we have before we start projects will be, we don't have data. So we have to go into the communities ourselves and get the data, right? And to be very honest with you, to be very honest with you, around the world, you see this thing you're talking about, which is getting data about communities, it exists. But in Nigeria, we don't. So it is a very open space for people to actually come in, and it's a career path. Yes. So yes, actually.
All right, guys, there you have it. Another career path for data analyst, data scientist in our midst. So let's be sure to explore it. And if you're just getting into the data space, remember there's an opportunity to get a class for free via Datalium. But so I don't take too much of our time. Linda, I know you have talked about the reason why we need data, why it just makes sense to have data to go into business. However, if you are to analyze the situation of things now, right? Would you say there is an opportunity for maybe so I get that some people do some sort of research before starting a business, but do you think there is more, right, that can be accomplished with greater level of knowledge of data, right? Especially when you see that these things have been done, and maybe the reason why we are limiting ourselves in this part of the world, whether as a newspaper organization or as a business generally, is because we don't have access to enough data. And how much opportunity or what opportunity is there for people to explore to even make the business or the journalism industry better? I hope my question is clear. Like, what are the opportunities for the average data science guy, right? So the average, what are the opportunities available in the business world, right, for the average data science guy?
Okay. I'm going to see how I'm going. Like, this is, you have like 4 questions in one, but I'd like to just quickly give examples of some certain things, and then explain to people why data is important. I'll give some examples based on our business research and all that of things that are happening and why we need to, have data. So first things, I talked about the fact that we need data across everywhere. Now, we need data across healthcare sector. We need data across, just give me a second. I need to just switch off this phone. 1 minute. Yeah. So we need data across healthcare, education. The government would also need data. So let's break it down. If, for instance, now in a particular area in Lagos Island, you want to come up with something, the only way you know what they really need is if you actually say, okay, we've done a research, and in that research, we've actually found out that 1 million people live here. They need this kind of healthcare center. They need the schools, and then from these schools, we're not just talking about schools. We're actually talking about the fact that what would they need in the school? Is there light? So then I used to volunteer to a school where we used to teach, and then we get there, the children are on the floor, then you are sweating. Sometimes it feels like I'm going to faint, and I'm only there for like an hour, 30 minutes. And these children will sit down there from 8 o'clock till like 4 o'clock in that heat. So research you begin to find out that it's not just about having good teachers. They need good chairs, they need good table, they need lights, because the schools don't even have access to light. Neither do they have generator or the funds to even power it. That's another thing. They need fan to be able to cool them because Nigeria is really hot. And then you're asking yourself, if I, who is just there for 1 hour, 30 minutes, going to run away, how will they feel the whole day? And if the book is really entering? Now, with the whole stuff about data, we've seen a lot of partnership amongst different organizations. So you've seen the one with MTN providing the Momo service, because we found out that a lot of people at the bottom of the circle do not have access to credit, loans, banking services, and the whole financial inclusion thing. So now, how do we take this to them? At least we've been able to solve one problem, which is having them, providing mobile phones for them so they can call, they can text. They might not be able to do all the whole thing we are doing now with social media and apps, but then if they have a phone, then they can text or do hashtags to transfer money, receive money, check their money, and then also be able to access the POS person at their corner and collect money. So MTN is doing that. They also did the one with Luminous where they are providing solar power and all. So you're seeing a lot of the telcos are sitting on a lot of data because they have access to a lot of people in the rural area. So they're able to kind of find out what is the problem. Can they charge their phones? Do they have access to financial inclusion? Do they have access to lights? Do they have access to education? There's a new guy who's also working on providing education through text messages and phone for people to prepare for JAM and for SSC. Data was able to provide that. The number and the rate at which we are growing. So NIMC is just recording, we just have about 63 million people who they have their information, and we are over 250 million people as at the last census that was carried out. So you can imagine how many people are born every year, how many people are dying every year. We don't even have that record. Now, but when we have that data, where are they? The government is able to find out, okay, what and what do we need to provide for these people? And then we will now bring it down to business level. Now, in the business level, we'll find out that we have a lot of problems in Nigeria. There's no light, there's no water there. But in this whole problem, there's a hierarchy of what will I need at every point in time. And it's only data and analysis that can help us find out, okay, this is what we need at this point in time and all that. And because we don't even have the people who are gathering it, we don't have the right platforms to store it, we don't have the people who are analyzing it, then we can't even get to the final stage of making decisions from that. So I would advise that, when people are saying I'm a data analyst, they're not sure, but I strongly believe that that's the future, because the time is coming before you do anything, somebody has to analyze and give you updates on how is it going to affect the healthcare sector, how is it going to affect business, how is it going to affect the things that we're doing, which means that the data analyst person will be key. So 4-5 years ago, in Business Day, there was nothing like data analysts. We didn't if you would say that word, people are going to wonder, well, what was that? What am I using that for? So we brought one guy who kind of transformed everything that we're doing. And he kept saying, this is how we should do it. Based on what I'm seeing from the back end, this is what people are searching for. This is what they want to read. This is what they want to see. This app will help us provide this kind of stories. We should be able to get the data of people so that we can also market our products to them. We know who they are, where they are, So that guy kind of changed our mindset and orientation to the importance of not just data, and then also having and analyzing it. That same guy was able to tell us, you know what, a lot of people are looking for information. How do I get to finance? How do I get to loans? How do I get money? And if you don't have the basic things as a business person, you can't even get those things. So he also now decided that we should create a website that will provide information and data for people concerning how you can get money, what you need to get the funds, how many businesses. You're just providing some basic things that, of course, we should have and the government should control. But it will now be a case of public and private working together to make this work. And this is going to be a long-term journey. It's not going to be next 1 year, 2, 3, or 4. It's going to be next 5, 20 years. But then at that point in time, you can easily walk into a location and find out how many people live here, how many hospitals are here, how many people have access to this hospital. Is it 1,000 to one doctor, or 10,000 or 1 million people to one doctor? You're able to find out. So do we need to have more doctors? Do we need somebody is helping you analyze those data properly? Before I end, there was something that I was able to find out that I strongly believe that if we actually do that and do it in the right way, we're going to solve loads of problems, and Nigeria is going to be a better place. Now, so there are 4 things we should look at. Number 1 is that we need to identify high impact areas. We need to start prioritizing what areas would really benefit from this data and how fast will they benefit. Let's focus on that. Number 2, we need to audit, the existing data and the gap. What do we have now? Okay, only 61 million people have registered. How do we make, so you can imagine how many years it's taking us to just register 61. So is it going to take us another 5-10 years to register another 60? So how, by the time we're done with registering all the people in Nigeria, half have also gone. Because people are dying every day and dying every month, do we even have track of those people, if they even existed? Where were they? What happened to them? Do we have records to say, okay, this is what happened to their life? And, can we learn to make life better for others? Those things are key. And then we need to look at, okay, the stress test existing tools. What can we even use? How do we keep this report in such a way that people have access to it? They can use it to make useful information to their life. And then number 4, which Data Lium is really, really focused on, and you guys have done an amazing job. I think this is brilliant. Close skill gaps with this training. We really don't have universities teaching people how to become data analysts and all that. You just have training centers and saying, you know what, this is the future, and the future is here now. You can't just wake up and do what you like. You have to find the data, find the right data, analyze the right data, and use it to make information. So when you're talking, like now when you're talking of statistics and figures. So they said here with this with confidence, and most times they're getting them online. How do we have the right people who have the right skill to be able to keep this information in such a way that in 50 years' time, we can go back to the past, use it to analyze the present, and then, use to make projections for the future. If we don't solve those and fill those gaps quickly, then it's going to be a very big, problem for us. And then it will help us in actually turning those insights into action. So we've been able to implement strategies. We've been able to identify the key areas. We've been able to find the right target data that we need. We've been able to analyze and collect them. And how do we use them? I think the key thing is if we can find a way to put all these things together and analyze them, it will just make our lives better, from health to security. I know I had someone asking a question about security. So sometimes you find out that somebody gets missing and MTN is telling you they cannot track their phone. How? But you can send me a text to tell me my data is running down. You can call me and tell me that, I've not been recharging my phone. And then you can't track my phone when something goes wrong. So sometimes it's really scary for me. It's really shady, like what's happening? And then something is happening. The bank can't even tell you how your money was transferred and who. And then you tell me there's a BVN and somebody registered and you know his details, and then you can't track my money. Something is really wrong. So if we're able to use this data and information, well, it's going to affect every area of our life. And of course, definitely it's going to make business really, really easy to, function in Nigeria. Thank you very much.
Thank you very much, Linda. Thank you very much. I must say again. So right about now, Miriam, we are back to you. Right. So tell us, what are the opportunities available for the data analyst, the data specialist in the lifestyle sector? Like, what are the gaps available for us as data analysts to fill in, and how it will make the industry even better? Okay, Miriam, we cannot hear you if you're talking. All right. So,
Hi, can you hear me now? Sorry, I forgot to mute myself. All right. So I was saying that there's a lot that can be done in the sector. Okay, so I'll just use as an example. There's this particular workout app. So it's not just a workout app. It's a brand that's created an app for itself. So what it does is that it has about 5 different workout trainers, right? And you can choose to work out with each of these trainers. So imagine if it was before data, before apps and things like that. You would have to go to the gym, meet with this person one-on-one, but in the comfort of your home, they're able to come up with an innovation where you can work out with world-class trainers, different types of them, any time of the day, but you pay, a stipend per month. So those sort of things. This was a company that when I started to use them and work out with them, used to send you paper, whatever, via email, and then you print it out and use it. But now, from data which they were able to harvest, from those of us who have been with them for many years, they understood how big their followership had grown and found better ways to reach us. So with Nigeria now, say first on the side of a person who is interested in improving their lifestyle, who is interested in the sort of food that they eat and the sort of things that go within their bodies. They want to pick up a box of a meal or something when they get to the supermarket and be able to look on the box and see information. What is the nutrition facts? What are the nutrition facts? What is the health benefits? What are the contents? When you pick up a food that's been imported, you see everything. You see how much carbohydrates is in it, how much protein is in it, what the health benefit is in it, if there are preservative use, sweeteners use, and things like that. And then you decide based on information that you have if this is the best for you and for your lifestyle. If you go to a Nigerian market to pick up a Nigerian product, you're unable to come up you're unable to make that decision because you don't know how much is carbohydrate, how much is protein, how much, what the health benefits are for you. If I'm diabetic, would this help me? Does this fall within the types of food that they say that I should take? We don't know that. So in that way, I would love if there's, I think for me, it's a lack of data issue. We don't have, first of all, we don't have those who are interested in collecting that data and putting it in such a way that is readable for just the regular man or woman on the street. Then secondly, for the person on the business side of it is many lifestyle advocates and brands and businesses would say to you, would help you either with your weight loss or to maintain your health or maintain your wealth, and also manage nutritionally and lifestyle-wise, maybe some of the ailments that you're going through that the doctor has said, okay, watch what you eat and your workout. But most of the time, we rely on American diets, American food, American or European information because they have everything written down. You can just pick up you can even just type in, the computer, a certain meal, and it can tell you how much carbohydrates it's in there, protein is in there. All those information, they are very important in helping your clients, but we don't have a lot of that in Nigeria. First, I understand it's because it's still a growing industry, but secondly, I also feel that Nigerians were not really into, specifics like that, because even when it comes to our medicines, people will tell you traditional medicines, they'll just tell you, just drink 1 cup, where others would say to you, take 1 pill a day after 3 hours, so that has just affected everything within the lifestyle sector as well. So in that way, I feel that it's data analysts will have a field day, coming up with data in readable forms for people like me and those interested in improving their lifestyle.
Thank you very much, Miriam. Data analyst, potential data analyst in the house. This session has helped us to realize that from our collective efforts, we actually can make Nigeria across different sectors into the country we want to see it, into the country we wish for it to be, right? Many of us say, oh, abroad, they are so organized, they have the database, no policeman is pursuing you when you break a law because they can always find you. But all of that is the result of data, and that is what we want. This the Italian has taken upon itself to encourage us that doing data analysis is not just because everybody is doing it, it's because it is the key to a sustainable nation. No nation can survive if they do not work with data. So again, I'd like to state that if you'd like an opportunity, anyways, I'm sure many of us are like big guys and big girls here. The Italian offers data analytics classes from beginner up to expert level. If you're interested, visit www.italium.com or reach out to any of the organizers here. Also, there's an opportunity for one person from this session to win a free beginners class. This data thing, we cannot finish exhausting it, so we want as many people as possible to be part of us. So finally, as we round off, if you have any questions that you would want us to address, either about getting into data analysis or what any of the speakers have spoken about, please drop them in 3 minutes and then we'll address them within 3 minutes, please. Thank you.
Hi, good afternoon. Please, if there's any question for me, I would like to take it. I will have
Okay, Linda, your internet is
I'm going
quite...
to run to. Please, thank you.
No problem, Linda. I think I got that. Yeah. In the absence of any question, I'd like to say a big thank you to everybody who has joined us for this. Oh yeah, Linda, we got that. Who has joined us for this session. It's been an interesting one, and by myself, I've seen many business opportunities. You know, that's what data does for you. It helps you to see products and new business opportunities. I'm sure each and every one of us have also seen a way to not only develop our skills, make our nation better, and of course, enrich our own pockets. So, personally, thanks to everyone. Thanks to the Italian for putting this together. Thank you to every one of our speakers. You've been amazing. And thanks to everyone who has stayed with us even till this very moment. Is there any internship opportunities available? Please reach out to a member of the Italian team and we will guide you accordingly. Thank you. Thank you very much, everyone. Do enjoy the rest of your holiday. Thank you.
Thank you.
Thank you, guys. Thank you, everyone.
Thank you, everyone. Bye.
Thanks, everyone. Oh, ya Allah.